Derek Blackmore.
DeQuay Falk.
Marsha Brady.
Nelly booked it.
My name is Kylie Sperano, and I'm going to give the demonstrative speech of CPR. So imagine on Thanksgiving dinner that you're eating dinner and a family member goes unconscious. Would you know what to do? There's a technique that's called cardiopulmonary resuscitation, or CPR. Today I'm going to talk about how it works, when to start CPR, and how to do it. How do I know CPR? I'm an EMT for 4.5 years, and I have been on too many calls where family members or bystanders do not start CPR when their family member goes unconscious. And by the time we get there, we start it, but it's normally too late to save them. First, I'm going to tell you how it works. When you're doing the compressions, you are acting as the heartbeat for that patient. When you're compressing the heart, it helps move the blood around. Then when you give rescue breaths, that provides the oxygen to the blood that needs to go to the brain to help the body survive. Upon shocking the heart with the AED, it sends an electrical current through the heart, hoping to jumpstart it into a normal rhythm. So, everyone that goes unconscious does not need CPR. First, you need to shake and shout. Annie, are you okay? No response. Then you check for a pulse. You want to check on the carotid because the wrist is too far from the heart to feel a pulse if they are unconscious. Then you want to look and listen for breaths. You want to look to see if the chest is going to rise and fall. If none of those are good, then you need to start CPR. The following steps are for CPR. You want to place your hands in the middle of the chest with your middle finger aligned with the nipples. You then want to interlock your hands like so, keeping your elbows straight and push down. Don't bend your elbows like they do in the movies. You want to keep your arms straight to get the most depth, and you want to go at least 2 inches. You want to make sure that the chest has time to recoil in order to give the heart time to fill back up before you compress again. You want to do a cycle of 30 compressions to 2 breaths. Now during the breaths, you want to pinch the nose closed so no air can come out of the nose. Cover your mouth with their mouth and blow out a normal breath that you would breathe out, watching the chest rise and fall with every breath that you give. And you want to make sure that the head is tilted back to allow for maximum airflow. And if you have an AED available, you want to set that up as soon as you can if you have 2 people. You want to put them according to the pictures on the AED patches. One goes on the front and then one on the side. When you are shocking, it'll go through the cycle and it will say shock advised. You want to make sure that everyone is clear, no one is touching the patient. Otherwise, you too will also get shocked and then you have 2 patients. So once everyone's clear, you'll hit the shock button and the patient will jump, their body will rise off the floor. For the non-medical people, they're also teaching hands-only CPR, which is you get rid of the breaths because they say that doing the breaths takes away from the compressions, and which when you're not doing compressions, you're not beating the heart, which decreases their chances of survival. So the hands-only, all you do is compressions until EMS gets there. So, in conclusion, lives can be saved by learning CPR. I have demonstrated how easy it is, how to do CPR, and when to do it. Now, I would encourage you to go out and get CPR certified through the American Red Cross or the American Heart Association, and you too can save a life. Is giving up 2 hours of your time enough? Too much to ask to save a life? Thank you.